Absolutely. I guess the how I would respond to that is the perception that there's an openness to discussion and debate, or that it's okay to criticize the CDC or to disagree with them. It was not. A lot of people didn't feel like that, or they felt like if they did that, they're somehow anti-science, or they're being called out as on the side of the virus, or that kind of thing. Do you hear that criticism, and what do you make more broadly of the CDC's response? We've been very critical of the testing screw up from the beginning with the CDC, and now we have monkeypox, and it seems like once again the federal health officials weren't totally ready for this pandemic. I know, for instance, the FDA had some issue with importing the vaccines because they hadn't inspected the facility. Exactly the kinds of errors that were made in the early days of COVID.
Well, first of all, I can only speak for myself. And I can tell you that I have always had an open mind to the comments of the community. I've developed that 40 plus years ago in my original interaction with the activist community with HIV. I always listen and take what I hear from the community. Sometimes that's incorrect and misguided, but sometimes it gives you important information and feedback from the real world. So I can only comment about how I look at things. When people criticize, I always take criticism seriously, analyze it, and see if there's anything I can learn and do better from the criticism. Sometimes it's outlandish, but sometimes there's a kernel of truth in that. So I have been making my own approach to this, which I've been doing now for decades, to always keep an open mind, which I still do to this day.
Well, go ahead, Batya.
I so appreciate what you're saying, Doctor, about the moving target. At the same time, there were authorities that made different decisions than the CDC's recommendations, for example, on school closures, and they did not see higher levels of child mortality when it comes to COVID. And meanwhile, the schools that did close down were now seeing just disastrous levels of learning loss among poor children, children of color, mental health crisis. I wonder if you would recommend locking down schools if you had to do it all over again.
Well, again, it's first of all, I didn't recommend locking anything down. You're asking me questions. You're talking about the CDC is the public health agency that uses their epidemiologists and their science-based approach to make recommendations. Clearly, whenever you close schools, there are collateral effects that are negative. I have always been well aware of that. And I have always felt, and you go back and look at my statements, that we need to do everything we can to keep the schools open and safe. And by safe means, if you need to wear masks in that, wear masks. Get better ventilation. Surround the children with people who are vaccinated if a vaccine is available to help protect the children. Again, I have been on the record of saying that always try to the best of your ability to keep the children in school, but in a safe environment. Locally, a decision is often made when there is so much infection to close the school, but I would always see that as a last resort, and I have always felt that way.